Your fertility journey with CCRM. CCRM's mission is to provide our patients with the fastest path to the healthiest baby. For over 30 years, our personalized patient care, world-class labs, and leading science and research has helped us consistently achieve high success rates. Men and women are impacted by infertility equally. To help identify the cause of your infertility, you will undergo a fertility workup. Through this detailed diagnostic process, we'll look at a variety of factors that could impact your ability to conceive. Fertility naturally declines as we get older. A woman is born with all of her eggs, and as she ages, both the quantity and quality of her eggs declines. As one ages, this decline makes it more difficult to become pregnant or sustain a healthy pregnancy without assistance. Most women in their teens and 20s have an 18 to 20% chance of getting pregnant each month. By 35, her chances drop to 10%. By 45, she only has a 1% chance of getting pregnant each month. Men, on the other hand, typically experience a decline in fertility around 45. Studies have suggested that older men are at risk of genetic sperm defects, which increases the risk of miscarriage, stillbirth, and passing on certain genetic conditions. As I mentioned, the quality of a woman's eggs also declines with age. As a woman gets older, more and more of her eggs have either too few or too many chromosomes. That means that if fertilization occurs, the embryo will also have too many or too few chromosomes, which decreases your chances of implantation and increases the risk of miscarriage or chromosomal disorders in a pregnancy. At the age of 30, approximately 70% of embryos are chromosomally normal. At 35 years of age, about 60% of a woman's embryos are chromosomally normal. By the time a woman reaches 40, about 35% of her embryos are chromosomally normal. We recommend that if you are under 35 and have been trying to conceive for 1 year without success, or if you are over 35 and have been trying for 6 months without success, to reach out to a fertility specialist. CCRM doctors partner with each patient to develop custom-tailored treatment plans using the latest techniques and technologies to help ensure the best outcome possible. While no two patient journeys are the same, CCRM is committed to providing the highest level of care to all of our patients as they embark on their journey to parenthood. All of our work and efforts is to improve your chances of taking home a baby. Your success is our success. The first step on your fertility journey at CCRM is a personalized fertility evaluation. Prior to your new patient consultation, you will need to provide medical records for any previous fertility treatments, annual gynecological exams, and MMR and chickenpox immunization records. Also, please speak with your primary care doctor to ensure you are up to date on required immunizations. If you're between the ages of 35 and 40, or have a family history of breast cancer, regardless of your age, we recommend a mammogram be completed prior to starting treatment. Before your first appointment, you will also complete medical history forms, which may include your partner's medical history and your family health and known genetic history. Your doctor and team will review these forms prior to your consultation. At your new patient consultation, your doctor will review your medical history with you. We'll start discussing recommendations for a plan of care specific to your medical history and family building goals, and they will prescribe testing that you need to complete based on your plan of care. On the same day, after you meet with your doctor, you will meet with a financial counselor to discuss any insurance coverage you may have and potential out-of-pocket costs for your testing. Lastly, you will schedule your appointments to come back for testing. CCRM's labs have some of the highest standards in the industry. Our research teams have worked tirelessly to determine the best environment, technology, and equipment to achieve successful pregnancies. We practice the old adage of measuring twice and cutting once to ensure your treatment plan is as precise as possible to maximize your chances of having a healthy baby. Testing tells us your current fertility status and any factors that may impact your ability to conceive. Testing is scheduled based on your menstrual cycle. First, on day 3 of your cycle, we will conduct blood tests. These tests will give us an idea of how many eggs you have left in your ovaries and how you may respond to various medications. We may also test for communicable diseases such as HIV or hepatitis, and we'll conduct preconception labs that look for underlying medical conditions that could impact your fertility. We may also screen for genetic disorders that could potentially be passed on to a child. Your physician may request that additional testing be performed that is unique to your individual situation. Typically, your next set of tests will take place between days 5 and 10 of your menstrual cycle. During this visit, you will receive a pelvic ultrasound to look for structural abnormalities in your uterus or ovaries that could impact conception. An HSG may also be completed to make sure your fallopian tubes are open and free of any blockages. You can complete these tests on the same appointment day, or they can be broken up into multiple appointments, depending on your personal preference. Next, we will perform a semen analysis to examine sperm quality and quantity if appropriate. This test should be performed following 2 to 5 days of abstinence and does require masturbation. Lastly, you will have a consultation with your nurse to review prescribed fertility medications and your current overall health, including diet, exercise, alcohol, and caffeine intake. Depending on your needs and goals, you may meet with other care team members such as genetic counselors and psychological counselors. There are many potential diagnoses that you could expect to discuss with your physician following testing. Here are some of the potential female diagnoses that we may explain to you. Here are some of the potential male diagnoses that we may explain to you. Your doctor will review your test results and explain any diagnoses to you and your partner, and will provide their recommended treatment options. Last, you will meet with your nurse and/or treatment care coordinator to develop your treatment calendar. As you start your fertility journey, we recommend that you prepare your body for treatment in the following ways. Eat a healthy, well-balanced diet, start taking prenatal vitamins, maintain a healthy weight, stop smoking, drinking alcohol, and recreational drugs, avoid travel to any countries or regions that may put you at risk of exposure to Zika or other significant infectious diseases, reduce or eliminate your caffeine intake, decrease your stress. We understand that fertility treatment can be a stressful process, so don't be afraid to ask for help. We recommend reaching out to a psychological counselor for support if you are feeling anxious or stressed. There are many fertility treatments available today. You and your doctor can discuss your family building goals and diagnosis to decide the best treatment option for you. If you have any questions about the fertility process or would like to start your fertility journey with CCRM, please visit ccrmivf.com.